Hello everyone, I am Savita from RPIIT Medical and Technical Campus. Today we will discuss on hospital admission and discharge procedure. Admission. Admission is defined as allowing a patient to stay in hospital for observation, investigation, treatment and care. Type of admission: emergency admission and routine admission. Emergency admission: in this, patients are admitted in acute condition requiring immediate treatment. For example, patient with RTA, poisoning, burn and cardiac or respiratory emergency. And in routine admission, in this, patients are admitted for investigation, diagnostic and medical or surgical treatment. Treatment is given according to patient problem. For example, patient with hypertension, diabetic mellitus. Unit and its preparation. Unit, it is a place where the patient is kept during hospital stay. The admitting department notifies the unit prior to patient arrival so that room bed can be prepared. Prepare the treatment table, ensure all the equipment are completed, check ventilation, ensure patient privacy. Special consideration during admission. Admission cause undue stress, emotional factors as well as financial capabilities must given utmost importance. Be observant, consider the individual patient needs. Provide an individual admission procedure, show may efficiency and concern. Admission procedure: meet and receive the patient, verify the patient data by check the record sheet and chart, introduce immediate personnel, assist the patient to the treatment area, ask the patient to change the clothes into hospital gown if necessary. Perform examination and evaluation procedure. Perform examination and evaluation procedure. Establish baseline values like vital sign. Do history taking, physical examination. Coordinate with the physician and carry out initial order. Give the treatment and instruction as needed. Orientation to the patient and others. The equipments and instruments, use of call system and telephone, treatment schedule, visitor timing, other healthcare team members, policy and rules and regulation, care of patient, valuable things. Orientation to the patient and others. The equipments and instruments, roles and responsibility of a nurse in admission procedure. Nurse should deal every effort to be friendly and courteous with the patient and family member. Make proper observation of patient condition. Continue orientation the patient and relative regarding hospital policies. Deal with the patient carefully who is suffering from communicable disease or illness. Isolation if necessary. Patient's values and clothes should be handed over to the relative with proper recording. Thank you.